Charlie Braverman, welcome back to Geological.
It's good to be back.
Yeah, I had such a great time talking with you about things like retirement. Holy smokes. People usually think about getting a practice going. People don't think about what it takes to take one apart.
Yeah. Well, I closed my office yesterday. That was September 30th. And I turned the keys over to a new tenant.
Sweet. Ooh, that's a powerful moment, isn't it?
Yeah.
That key handoff moment.
Yeah, it was.
Wow. All right. Congratulations.
Thank you.
On to the
Thank
next
you.
phase.
The tough part actually was the key to the public restroom, because you can always find yourself needing a restroom. You may never need that office again, but you may sometime find yourself needing a restroom. I had to turn that in too.
I can remember having a key. We called it the executive washroom when I had my clinic at the Pike Place Market.
Yeah, that's right.
Yeah, that key was always on my keychain because you never know.
You don't.
Well, anyway, we're not here to talk about retirement. We're actually going to wind the clock back. We're going to go back in time a bit. I want to talk to you about the work that you were doing with electroacupuncture, microacupuncture. I don't know a lot about using electricity in acupuncture, even though I had a course in school. I've talked to several people on the podcast. It's one of those things I just can't quite get it through my head. So I'm always happy to sit down and take another run at it.
Well, let's give it a try. So the first place I might start is to differentiate between what you and I learned at school, which is electroacupuncture, and really what I worked with for 18 of my 20 years in practice, which was a microcurrent electrotherapy that was very simpatico with acupuncture and acupuncture techniques, but was not acupuncture. And in fact is being used by, of all things, chiropractors, but also by ophthalmologists, neurologists. Yeah, neurologists, oral surgeons, physical therapists, athletic trainers. It's adaptable to all of these health professions, and they're all figuring out ways to use it, usually in ways that you and I wouldn't use it.
Great. So there's a lot to learn today. Let's start with the difference between what we learned in school and the kind of stuff you were doing. I know for myself, and it's just because I'm kind of sensitive. I'm one of those sensitive people. I like acupuncture. Getting needles put in me is always not fun, but I like the effect. And like strong treatments they just never set with me. And so I never really liked doing them. And I can remember doing electroacupuncture. And it was just like, I just felt like I was being a barbarian. Like, all right, I'm going to hook my patient up to the car battery now. And I never got a feel for it. So I'm super interested in hearing about this other thing, and hearing about microcurrent makes me think, oh, that just sounds more gentle. And that it's got all this other range of things that it can do just sounds exciting. So,
and in fact, it is. Let's first clarify. In my mind, electroacupuncture is usually a milliamp kind of experience, and it's attached to needles. Often enough, the patient is asked to find that sweet spot where they can feel it, but it's not uncomfortable. And they feel the pulsing. And that pulsing might be very slow at 1 or 2 pulses per second. That's hertz. Or it might be very rapid in the neighborhood of 120 or 200 or even higher. And they'll still feel something, but they won't feel the individual pulses. You adjust anywhere from 1 milliamp up to whatever is the toleration level. It could be 15 milliamps for a neuropathy kind of experience where there isn't a lot of sensation. And it's usually, and I'll tell you, Michael, I'm sure you have listeners and experts who can really tell you a lot more about electroacupuncture and milliamps. But in my mind, I understood it always to be doing a couple of different things, or at least one of those. Sometimes it's just exhausting that muscle that's pulsing to the point that it has to relax. And so you're working with a spasmed area and forcing relaxation upon it.
So a little bit like sometimes dry needling is used. You go in there, some strong stimulation, you get it to twitch, it relaxes.
Hmm.
In this case, you're using the current. Maybe it's taking a little bit longer, it's a little bit more gentle, but you're just wearing that dang thing down. It's fine, 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 I'll let go.
That's right. That's
Okay.
right. Dry needling is finding that trigger point or that motor point, ideally, and tapping and tickling and working with it till it relaxes. And I think that's a great effective technique. The other thing that milliamps can do is provide a white noise, because a nerve can only carry one signal at a time. And if that signal is pain, this can override that and provide essentially a white noise, a non-pain signal. And those are both real benefits. There are other things that it can do, and it can certainly do things that go beyond just the moment and can instigate, like all of acupuncture, instigate the body's repair and immune systems, and it does all of those things too. I also, like you, had that sense of that car battery. I worked with it in school, I worked with it in clinic, and I worked with it in my practice. But ultimately, and by ultimately, I mean within 2 years of starting that practice, I was working with microcurrent. And microcurrent is 1,000th the intensity. So it's working with millions of an amp rather than thousands of an amp.
So it's almost like a homeopathic dosage.
It is, but where homeopathic, you're leaving simply the trace memory within the water. It's bound in there in some fashion. This is not that. This is simply as low a dose as you can possibly get. One of the benefits of that is that it can work at the cellular level, and we are electrical beings, and milliamps can work with broad muscle bundles and do all kinds of things, but this has the trick of being able to work and change cell response. And one of the ways it does that is by increasing the production of ATP. And ATP is the energy molecule in every cell, and then you leave it to cell wisdom, hopefully, to decide what's to be done with that.
Okay, so I got a question about that.
Yeah,
When I hear things like it increases ATP, the scientist part of me, the guy that lives in Missouri, the show me state, that guy wants to know, how do we know that?
you can measure that. And so the only way I know it is that one of the first journal articles about what I use, frequency specific microcurrent, measured an increase in ATP over some short period of time.
Okay, so there's ways of studying this and measuring this, and indeed they've found this. Okay, all right. Because sometimes I hear things like, "Oh, this and that, it will like change someone's DNA," and I'm like, "Really? How do we know this?"
That's right. And I agree with you. I want to know these things. I want to know how this, I want to know that you can prove this, and I want to know that I can replicate it. And
Yes,
of course,
especially the replicate part.
that's right. And what I know is I don't know from my practice what happens to ATP. I know from my practice what happens to a frozen shoulder, or what happens to gastritis, or to a large intestine that's inflamed, or to arthritis in a knee. Since I can watch that process, I have to assume that there's ATP involved in the chemistry changes along the way with those things.
The scientific mind of mine really likes hearing things like, "Oh, it increases ATP." Well, that sounds like chi to me, the way that I think about things. But of course, the most important thing is what happens to the patient and the problem they walked in with. Hopefully, they don't walk out with it. And the clinical results. In some ways, I don't care about the theory and how it works. I just want to know how to work it.
Yes,
Yeah.
yes. And you mentioned that gentle part. And so there's a couple of things about that. Number one, when you're working with millions of an amp, you're typically not working with anything within the range of sensation. And so my patients often would have to simply trust me that there was something going on for a period of time. It's not like a needle. And while in my mind, the microcurrent was the workhorse in the treatment, they needed to know that I was also placing needles on either side of this or along a path, or that was really an important part uh, of the experience for them to know that.
because they're going to the acupuncturist.
That's right. They're going to an acupuncturist,
So give me some
and
acupuncture.
that's it. Yep. Um, and usually, most of my patients ultimately agreed with me that it was the microcurrent that was working, but not all of them.
Yeah. Now, would we're going to get into the nuts and bolts of that here in just a
Nuts
moment.
and bolts. Yeah,
But before we do that, I'm curious to know what you thought about using it with acupuncture. Did one potentiate the other? Could you use the microcurrent to help increase the effect of the acupuncture, or were these like just two separate things that you were doing that each kind of worked in their own way? Well, I'd like to know how you were thinking about that.
sure. It's a question I think I've been asking myself for 18 years. So I don't know that I have a full answer, but I can tell you that I would begin almost every treatment with something that was completely acupuncture oriented, and that was I would use ion pumping cords with extra vessels, extraordinary vessels,
So
and
you kind of come from the Japanese side of the house.
I very much
Mhm.
we had a strong Japanese track at the New England School of Acupuncture, which is where I went to school. So yes, so that's where I would begin. It was an easy way to balance and center, and from a patient's point of view, relax. That was a really good place for me to begin also.
Yeah, talk about taking the noise out
Yeah,
of the system.
that's right.
Yeah.
I would never do anything that would be sham acupuncture. I won't just put a needle in a body simply to make sure that there's a needle in a body. So I would always place needles in appropriate points for the issue that we were working with. And so if we're working with GI issues, then the microcurrent is working directly in the abdomen, and there are no needles there. But I'm working with needles along the spleen and stomach and any other channels that might be appropriate. But how effective they were, well, I think it's very effective to work with the meridian, the classic points on the meridian that are below the elbows and below the knees. If I'm also trying to treat that knee, then my guess is that there isn't as much impact of a needle placed. If I'm working on the right knee, then I don't think that placing a needle at stomach 40 is nearly as effective as the amount of electricity that is just thoroughly surrounding and and running through that area at that moment. That's an overwhelming experience for the knee, for all the tissues involved, and that subtlety of an acupuncture meridian seems to me to be maybe off to the side.
I don't know much about this yet. I'm going to learn more about it as we go through this conversation. When I think of using different kinds of modalities, for example, if I want to do some moxa, I've recently been learning this on take method, which is really interesting. It's this warm bamboo, and it's not very smoky, which is good for me and my sensitive lungs. But often I'll do something, if I'm going to do something local, in your case, you're doing some microcurrent, in my case, maybe some moxa. I often want to go really distal to wherever I'm working because it just seems it's like you get a lever on it that way.
Yeah, it's true what they say about chi. It's strongest.
Can I quote you on that?
Yeah, it's true what they say about chi. I'm going to write a song in my retirement, and to be able to use those points, that's what I would try to add as much as possible.
Mhm. Okay. So you're not using needles. Are you using like pads, like TENS pads or something else? What's the equipment that we're looking at here?
10 pads, but most often, acupuncture is all about precision of point location. And what I used was a precision of a frequency, and we can talk about that. But I would start out with just a damp towel, actually two, because you always have to have current go from one point to another, from one lead to another, whether it's two needles. So if somebody says, I've got this really strong arthritic knee and it's painful whenever I walk, but especially when I do this, and we know a lot more about it by the time we get started, I would take a massage towel, dampened, and wrap it completely around that knee. Take a smaller towel usually, and either wrap it around, say, the other knee or the ankle or somewhere that I wanted the energy to circulate. It's a very friendly setup from that point of view. I don't have to think about that, and I don't have to work on deep needling into those points of the joint, and so all of that is easy.
So you're really looking to like bathe an area.
Bathe is the word.
You're looking to bathe an area in this microcurrent. So you use a towel. I get it how that's conductive. Then do you have leads? I mean, how do you
Yeah. So you then attached to those two towels. You attach two leads to each, because what you're doing is working with two different frequencies always. It's called interferential waves, and it's an essential piece of frequency specific microcurrent that you're working with a frequency pair. And what that means in terms of the physics of it is that you're not working with just these two frequencies, but as they interact, they create frequencies or waves. They create a whole range of harmonic waves, some greater in amplitude, some less, and you get this harmonic benefit from that.
Mhm. So it's like if you have a still pond of water and you throw a pebble in one portion and you throw a bullfrog in the other, you're gonna get 2 different kind of waves. And
That's right.
they're gonna come together and they'll make different patterns and,
And
you know
that's right. And you can watch exactly all those interactions on the surface of the water. Yep. And that's what's happening in the area that you're bathing with this frequency pair. One of those pairs targets the tissue that you want to treat. And by treat, typically your patient says it hurts, so you want to reduce inflammation. Um, the other frequency is identifying something about what's causing that inflammation. So we're talking about arthritis, and arthritis can be caused by spurs in the tissue. You might have bone spurs, or I'm probably not good at describing what might cause arthritis, but you're treating this inflammation component. So when I would treat it, I would treat toxins that might be in the area. I would treat mineralization in the area, spurs. I would treat infection, and there are basic frequencies that just reduce inflammation in and of itself.
this is probably great for plantar fasciitis.
It is. It is. But with plantar fasciitis, for example, and it's true of all of these, somebody says arthritis, plantar fasciitis, it sounds like it's a fascia issue. Typically, it's a diagnostic tool that hasn't been evaluated via measurements. The fasciitis is inflammation in the fascia, but you really have to decide whether that inflammation is the fascia or the tendon or the adipose pad on the heel or the periosteum. And if you're treating the wrong one of those, then there's no effect. And that's one of the things we know for certain is that if I direct that energy to fascia because you came in and said it was plantar fasciitis, and the inflammation wasn't in the fascia,
If it's
then
bone and not fascia, then you're gonna miss it. So it's just like with Chinese medicine diagnosis, right? Or I think it's the kidney. Well, I treat the kidney. It didn't help. Maybe it even made it worse. Oh, I guess the issue wasn't the kidney then. Now you gotta go searching. What else could it be? So our Chinese medicine way of thinking is very, very helpful for this. It's very similar.
absolutely. And because in Chinese medicine, we always have to take somebody's Western diagnosis, at least in this country, right? Somebody always comes in saying, "This is what I've got," and we always have to parse that and start pulling it apart and finding out what the symptoms of that are, what that really means, and treat that.
Mhm.
And it's exactly the same here.
Yeah. Okay. So it sounds like you've got different frequencies that go to different places. Some go to the bones, some go to the fascia, some go to the tendons, some go
Hmm.
to muscles.
Yep. Nerve. Yep. Hmm.
Okay. So you've got like a sheet of, you have to learn what frequency goes to what
You
thing.
do. You do.
Mhm.
There are a couple of hundred frequencies, and more are being identified for body parts.
Now, how did they figure this kind of thing out? Again, I'm Mr. Show Me State over here. How did they figure that stuff out?
Yeah, that's a great question. But of course, who figured out the meridians? Who figured out there are intuitives who simply are a part of every discipline. Some of them do it by trial and error,
Mm.
and some
That
of
would
them
be
do it.
me. That would
That
be
would
me.
be
I'm not
you.
intuitive, but I do, this is why it takes a while to learn how to practice stuff because you got to figure out what works, what doesn't. It's like how it's my thinking is working like this, but I'm not getting results with that. All right, I got to change my thinking. And then maybe you start getting results and if they're replicable, oh, now I've learned something new.
Yes. And so, for example, I'm somebody who it sounds very much similar to you. I'll listen to what you have to tell me, but I need proof of it. And if the only proof I have is in my clinic, then that's where it's going to be. So when I say that I have this list of 200 frequencies for body parts, I don't think all of them are necessarily effective for whatever reason, but enough of them are that it's a workable system. I think that I learned a point system in acupuncture that was 360 points. I don't think it was coincidental that it was the number of days in a lunar year. I think it was that somebody had to find some points to make it work at 360 or eliminate some points because we now know that there are other points. So I think every system has those points in the case of acupuncture and those frequencies in the case of my work that are that are reliable, stronger. That's what we've got.
To me, these things seem like a map.
Yeah.
It's like here's a map of a terrain. Do not confuse the map with the terrain, but use the map to explore the terrain, and then the terrain will tell you what's really true.
Yes, that's right. That's a great way to put it, by the way.
Well, when I first went to acupuncture school, I was like super skeptical. The dang stuff worked for me, and I was curious about it, and so I went. But I can remember, especially in my first year, we're reading these books, and there's this point, it does that, and blah blah blah, and everybody I'm in school, it's just like, oh yeah, this point does that, and I'm thinking, some dude wrote this in a book. How do we know it does anything? I mean, how do you really know? There were moments I can remember studying and thinking, what am I doing? This is crazy.
Michael, you sound like you're past that. It sounds like you actually made your decision that it's all those points, those ideas, those concepts. They work.
Well, it was because of clinical experience. There would be things like going into the clinic, putting a needle into a point, and having the patient go, "Ooh, wow, I feel that in my finger." And I would trace the channel. I go like this, and they go, and their eyes get all big, like, "How did you know?" I'm
Hmm.
thinking, maybe this shit works. Maybe this stuff in the books. All right, it's just a little tick mark. All right, maybe it's reliable. But again, I'm super skeptical. I want to try stuff out. I'm happy to learn a theory. I'm happy to take on new ideas. I love ideas. But man, it's got to pay some dividends in the clinic, or it's out and, it's in the trash can. Here we are. This is like the fall of COVID now, it was the winter of COVID, spring of COVID, summer of COVID. We're almost coming around full circle now. Is this the kind of thing where if someone had a machine, you could tell them what to do, like in a remote session, and they could treat themselves?
You could if you knew exactly what to treat. And you'd also have to have a machine that can dial into a specific frequency that in my world runs from 0 to 999. And most of us don't have machines that can do that.
Okay, so the most of the machines that we have, maybe I'm being a little dramatic, they are more like the car battery. You're talking about something that's got a little more finesse to it. Are
That's
these
right.
things expensive?
They're getting less expensive all the time. So when I started out, the first setup I bought was about $5,000,
Oh my
and
goodness, that's an investment.
that's an investment. It was an investment for me, but that was an all-round tool. I was using that for standard electroacupuncture, so I was using it for milliamp, microamp. It was a really powerful tool in my practice. I had probes with it, but you can buy a good setup for probably $2,000 now, which is still in this world of acupuncture. I recognize that's a significant capital outlay.
It's funny. Sometimes people talk about, oh, it's so hard to get a practice going. And I'm thinking, well, actually, the initial capital outlay is some boxes and needles, a table, and rent somewhere. I mean, it does not take much to set up an acupuncture clinic. But okay, so we're looking at about 2 grand for one of these things now. Someday, it's just you're gonna be able to take your iPhone and like stick it on someone and just download an app. But we're a little ways away from that, I suspect. So these things are about 2 grand. Yeah, you probably don't want to ship it to a patient just in case it doesn't come back.
Well,
I
you
mean,
take
I was just thinking with the telemedicine thing these days, it'd be cool if there was something easy and safe that you could have patients do.
well. In fact, you're describing one of the ways this is used. There are take-home models that will be very limited, because I'll program the protocol and I'll give it to my patient, and they will take it home, and I will have their credit card in case they don't bring it back. I'll charge them a nominal amount to do it. It's very, very easy for somebody to set up at home. The difficult part is the practitioner knowing what to line up for them. Does that make sense?
Yes, it really does because it's always, it's like when people go to the physical therapist or the chiropractor for acupuncture.
Yeah.
All right. Well, acupuncturists usually have some more software to work with in terms of knowing where to put those needles.
But in this case, all they have to do is know how to wrap a damp towel around their knee and have one other lead set up somewhere else, and that can be any place of convenience really, and then turn on with 3 buttons. They'll have started up a small little unit about the size of maybe three or four cell phones stacked together. Then they can sit and watch TV or work or sleep.
How long do you leave this thing on for? Is there a particular amount of time that's optimal? 20 minutes, hour, 12 hours? I mean, go to go to bed with it. That sounds interesting.
Well, it is time sensitive,
Mhm.
and so like everything else, it's how complicated is this particular presentation. If you've sprained an ankle, then mostly you're just working with ligaments, tendon. Maybe you're working with one or two other things, but there's no depth to that injury, no chronicity to it, and so that takes much less time. And so just like acupuncture, the more something has wormed its way into the system, the more ramifications there have been, the more ways we've compensated, then it's a little bit more challenging and deeper. You can certainly benefit from longer periods of time, and that can mean 3 hours, 4 hours, 5 hours. You can run this for a longer period of time, depending on the situation, and get additional benefit.
I'm thinking of a patient of mine right now I've been treating for frozen shoulder. His range of motion is pretty good at this point, but it's still painful when he sleeps. It's tough at night, sleeps, gets really achy. And now I'm thinking, wow, if I had one of these and he knew how to use it, that might push him a little quicker or maybe much quicker into healing. I mean, we're getting somewhere with this,
Sure,
but
sure.
it sounds like this microcurrent might be a great adjunct that he could put on while he's having the problem, which is sleeping these days. He'd get better sleep, and we'd know pretty quickly within a couple of days how it was working.
You would. That's right. In fact, I would treat frozen shoulder. What I discovered, and I say discover because that's really what it is. You're exploring. Somebody comes in with frozen shoulder, and it's been described to them that there are significant adhesions that are compromising movement. What I would often discover is that when I would just run different kinds of inflammation frequencies, not working with adhesions at all, um, that they would gain 50% range of motion within 1 to 2 treatments.
Wow, that's fast for frozen shoulder.
Yeah, and that's because it wasn't adhesions. It was it was the body's own remarkable mechanism, which is if the brain understands that moving this arm in this way is painful, then it creates this rock solid spasm that will not allow the arm to be moved.
Mhm. It's not gonna, your brain's not gonna let you hurt yourself.
That's right. And so if you can agree with the brain and treat the issue, then the brain can relax and allow it to move again.
I mean, this really sounds like it dovetails with how I think about Chinese medicine. It really does. Now you're really getting me interested in this, especially because it's not the car battery type. I can remember working with that, and there's that little space where someone goes, "Yeah, I'm starting to feel it," and you go just a little tiny bit more, and they're like, "Ah," and they're like jumping off the table because it's super strong. So I like the gentleness of this, and in the idea that you can target these frequencies to where the problem is. I mean, that really dovetails with the whole idea that we do our differential diagnosis because we want to know what the root of something is so we can do something about that. We're paying attention to the branch manifestation as well, but we really want to get down to that foundational aspect. And it sounds like this has its own way of doing that.
That's right. Exactly right. And I think that the training I had in TCM prepared me to think in that way. I think you're absolutely right.
You mentioned that the first unit that you had, you paid more for it than I paid for my first car. And it had probes and this and that. When you say probes, it makes me think, oh, well, maybe you could put a probe here, put a probe there. You can, very specifically put the current where you want it to go. Would you ever or could you use this kind of microcurrent hooked up to a needle and put it between two needles?
Oh, you could. Going back 18 years, when I started, I would often take an electrode pad and just place it over a single needle because I was still very much in the mindset of an acupuncturist. And so I would take classic points for treating knee pain, for example. And so what would that be? That might be stomach 36 and spleen 10. I would use those 2 points with needles, place electropads over those, and that would be one of the two. I would always need to do this. Remember, I would need 4 different points. So I would
Because you're
have.
doing the 2 different currents so you can get
That's right. Yep.
these, so they create a certain kind
Interferential
of
waves.
pattern.
Yeah.
Yeah. Say that again? What kind of wave?
Interferential.
Interferential wave. That's a great word, interferential. All right.
Interfering.
Yeah.
Yeah.
Interfering waves.
Hmm.
Interferential. Okay, now I understand what that means. So in creating these waves that create a kind of interference, it's the interference, the wave that happens through interference that's doing the work?
That certainly is essential to it. Yep.
Mhm. So it's probably both and. You got the each of the
Right.
waves
You're
on
not
their
going to discount
own.
the initial wave, but
Right.
the benefit is whatever harmonics there are to the unique series of waves that come from the interplay of these two frequencies that start out. For example, and if we're treating this knee, and we want to treat the cartilage, and somebody comes in and says, I'm almost bone on bone, so I have very little cartilage. So you know that there's a lot of inflammation directly in whatever remains of that cartilage. So that cartilage, the way you target that is using 157 hertz. And the way you target the inflammation typically to start out is running 40 hertz. So now we know that one of these 2 channels will be 40, the other will be 157, and it's that interplay that you're looking to accomplish.
Earlier in the conversation, you mentioned that when you began, you would often use ion pumping cords, and I'm thinking about, like, master coupled points, right? You got these 2 different energies, and you're hooking them together and creating a communication between them. This sounds very similar in a way.
I think it is. And I was very lucky to have started my practice with these very, very thin ion pumping cords that would accomplish so much, and they were so different than these massive, relatively massive clips that I would put on for when I would use electroacupuncture. So yes, absolutely, it was probably a great preparation for that.
It's funny how we follow one path and then something comes along and it just kind of adds on to it.
Hmm. Hmm.
Yeah. So you initially were putting pads on acupuncture points, but it sounds like you weren't all that crazy about the results you were getting.
They were okay, but
They were
it was a
okay.
lot of extra work
Mm.
for a lot of extra work, and I finally decided that I much more wanted to bathe the entire area in this microcurrent rather than these 2 slim electrical channels, and it just seemed to have more benefit to me
So you
inherently.
got better results.
I did get better results,
You got better
absolutely.
results. Okay.
Yeah.
Well, there you go. That's the
Hmm.
important thing.
Hmm.
Wow. Did you use this in all the treatments that you did? I mean, it seems like you became like the go-to guy for this stuff in your area.
Well, I was not the only guy. I was almost the only guy in the area, and we were made for each other. So some people are made for master tongue techniques. It's kismet. Um,
Yes. I
um,
couldn't agree more.
yeah.
So often I think in our community, we can get very, tribal, shall I say. "Oh, this method's the best method, and this is the method I do, and I market myself like crazy with it," but yeah, I think it's because we just gravitate towards something. It just fits who we are. So, for example, I loved getting Japanese acupuncture, and it was fascinating to study it. There was no way I was gonna be a Japanese acupuncture practitioner. No way. I just don't have that kind of super detailed, very ginky, it's like here and this and that and just this sort of way. I l I so appreciate people who can do that. If my wife was an acupuncturist, she might be like that because she's, like, super detail oriented. But that's not me, man. Give me, like, give me a broad brush to work with, and I'm happy. So, yeah, I think the method, in many ways, it says more about who we are as people than the effectiveness in the method itself. Because I think any method that you understand, you can make it work.
Yes, yes. And well, that's just it exactly. I think you've said it. And this was a method that I just connected with. Part of it was I studied acupuncture in my late 40s, and I unfortunately, for me, I felt like I would always be a little bit of a foreigner. I'd learned a new language. I really felt like I would always speak it with a strong accent. To be able to convert that back into blood and guts, just back into anatomy and physiology, which was much more the world, the actual world that I live in, and use enough of that TCM world to to support and enhance. That's what made it work for me, is that I could be fluent in a world of anatomy and physiology because that's what I'd understood all my life.
Yeah. It's such a great analogy that those of us Westerners who learn this, we grow up in the Western world, we have a Western mindset. We may have opinions and maybe not good opinions even of conventional medicine, but we grew up in this world. We're never going to get rid of that kind of nuts and bolts, biomedicine way of looking at things because it's our mother tongue, if you will. Can we learn to speak another language? Yes. Can we learn to speak it really well? Yes. Will we always have an accent? Well, I think most of us will have an accent.
I think that's it. I think that's it exactly.
Yeah. We often have to translate back and forth in our own minds and so you found something that could kind of bridge that.
Yeah, yeah. I'll just say one more thing about that, which is that I don't know, but I have a feeling my understanding of chi is somebody who's colorblind, their understanding of red. They'll get an understanding of it. They'll know it in certain ways. They may know it by the richness of the hue, but they won't know it by red. And I didn't believe I would ever know chi the way the way somebody who'd been born into that culture might know it.
Well, I think it helps if you speak Chinese and it helps if you're in that culture. I remember when I was studying Chinese in Taiwan, that was back when we had to carry a dictionary around
Wow,
to
sure.
to look words up. It wasn't on the phone, and back in those days, I had a Palm Pilot, which was like the coolest little handheld thing. And when I was beginning to study, they had just come out with this thing called Placo, which you could like write a character on it. It would give you a basic definition. It was mind blowing because instead of carrying around this like 2-pound book everywhere, I could have it on my Placo. But that Placo came about a year after I was already studying, so I was used to carrying around books. And one of the things I loved about carrying around a Chinese dictionary is when I would go to look something up, which was frequent, it'll have the character, and then it's gonna have all the other words that that character is a part of. So depending on the character, maybe there's just a couple of biomes that have it, but there's other words. I think I think there were 3 pages of biomes using the word "qi." And you could just so it wasn't just qi like, we think in Chinese medicine, but, like, weather was tian qi, sky qi, right? And complexion was mian qi, right? Face qi, and there's, like, all these different kinds of qi, and you because of that, I began to get a flavor for, oh, qi is this thing that kinda permeates how something is. It's still hard for me to explain it in English. But your description of a colorblind person seeing red, it's very similar. And if you can speak the language and you actually see red and red. Chi is definitely a slippery term. I'm always a little bit hesitant when people say they really understand it.
Do you use chi when describing an issue to your patient?
I do my utmost to never use that word with my patients.
Yeah, exactly.
And I don't like talking about energy either. I do my very best to speak about it in a way that's grounded in what they understand about how the body works. Because otherwise some patients like it, when you talk Chinese medicine to them because it's kind of a groovy thing and they just, they kind of dig it. I think most people, they get lost. And for me, it gets in the way. Actually, by and large, if I can not talk to them about what I'm doing, that's even better. Just let me do the work. Let me put these needles in, and you just like close your eyes and go to AccuLand, and then we can have a conversation when you come back.
Well, that's
That's
right.
my preferred way of working.
Yeah, yeah. And that was my preferred way too. I ended each treatment by explaining what I had done or what I had hoped to do. I didn't really want to have a conversation when what I wanted was, number one, to focus on what I was doing, and I wanted the patient to really just be able to experience it.
Yeah, just receive. Just sit back and receive. Yeah. So if I was to, or anyone who's listening to this right now, was to want to start dabbling with this kind of thing, how would I get started?
There are now a couple of different organizations that can teach you the basics of it. You can go to frequencyspecific.com. You can go to YouTube and watch
Oh, of course.
webinars that are already
Everything's on
there.
YouTube.
Sure. So you can see what this looks like and get a sense, would I ever want to do that? Would I ever want to participate in that? And do I like what it's doing?
That's a great idea. Go sit on some YouTube. You know, I've got a podcast. I've worked in technology for a long time. I did technology before I did Chinese medicine, and yet I'm still so old school in some ways that I completely forget. You can go on YouTube and learn a bunch of stuff. It's a great way to go and sample things before you actually throw your money down. But no, me, I'm like, let me go to the library and find the book. I could just go to YouTube, but I like never remember. You're like 10 years older than me, and you know this. I'm wondering if I'm ever going to figure this out. Thanks for the reminder.
Oh, it's okay. It's okay. Yeah, YouTube it's a remarkable resource.
Yeah, that sounds great.
Mm-hmm.
So frequencyspecific.com, YouTube.
YouTube,
Can start to get a feel for this.
frequenciesthatheal.com.
Frequencies that heal.
Yep.
Mhm.
Is another great beginning resource. Just like everything else we know, um, you're going to need to attend a weekend seminar. You're gonna have to learn how to put these things together and what they really consist of, and explore what that really means, and how do you begin to evaluate in order to know which frequencies to use? How do you know as you're going along whether you are making progress? So
Mhm.
all of that.
Yeah, and how soon you can expect results and that kind of thing.
Yep. Yep.
Okay, a couple of lightning questions here.
Sure.
I'm thinking about the stuff that is so hard to treat. I wish I could treat it well. I feel like I should be able to treat it well because I'm an acupuncturist, and the acupuncture books say you can treat it. But there are some things it's just like, man, I can't treat it. So, how does this work for tinnitus?
Ah, it's the same as everybody else.
Same as everybody else.
That's right.
Okay.
Yeah.
All right.
If you're lucky enough, there are just too many reasons, too many causes for tinnitus. If you're lucky enough that it's just simple muscle tension from anxiety, and you can just relax that area, or it's related to a TMJ experience, then there's a solution to it.
You probably have
But
some good results, but, like,
yeah,
let's say, like, nerve damage, nerve death, that kinda thing.
that's there's no
That's
way to deal with that.
yeah.
Nerve death. This is a great tool for a lot of neurological issues. I had a small cottage industry treating shingles because it
Mhm.
could treat shingles.
Man, that's a great man, shingles is no fun.
Shingles is no fun.
Yeah, so if you can treat shingles,
Yeah,
that's super helpful for people.
I had a good word of mouth practice, but usually people wouldn't find me in the best time frame with shingles, and so I would typically be treating the remainder of shingles, which is postherpetic neuralgia, which is still treatable but tougher. I had a website that I created, Albany Shingles Therapy, and I thought, well, this will
Good
get
move.
business. Well, it was, except I was getting more calls for people who wanted roofers. And so I shut it down because I'm scared of heights.
Hey, here's a good idea. Oh, maybe I should rethink those search keywords. Yeah, that's funny. That's funny. So what about, like, I know Bell's palsy responds very well initially to acupuncture. Like, when people call me, they go, "Oh, I just got Bell's palsy." I'm like, "Great, come on in, because we're gonna be good to go." But if someone's had it for, like, 6 or 9 months, that's usually more difficult. Were you able to budget with the microcurrent?
Yeah, but not always.
Not always.
Not always.
Again, you have to dial in. Is it a tension thing? Is it an inflammation thing? Is it a nerve death thing?
That's right. If the virus killed the nerve,
Mhm.
then there's nothing to be done.
Game over.
That's right.
Mm,
But if it was just an injury, we could typically do something.
cool. What about women's health? PCOS or infertility or things like that?
It works really well with gynecological issues. Working with poorly paced periods and with endometriosis is very amenable to this. That was a small part of my practice, and I never worked with fertility issues, so I can't tell you, but it should have been a real strong benefit. Um,
Well, if you can get endometriosis to budge,
yeah,
then, I mean, that right there is gonna already make women more fertile.
that's right. That's right.
Mhm,
I certainly had patients who would inform me that they had gotten pregnant within a period of time after our treatment cycle, and they attributed that to the work that we did.
mhm. What about psychoemotive stuff? Anxiety, depression, ADD?
There are practitioners that work with all of that, and I didn't in my practice. I know the work is being done. It wasn't where I wanted to direct my energy because I didn't really understand it as well as I really wanted to treat what I considered really serious things. On the other hand, I treated a number of athletes who had repetitive head injuries, and that was a very effective treatment for that.
So it's super helpful for concussions and that kinda thing. That's a big thing these days. I can't tell you how many teenagers I see for concussions. It's ridiculous.
Yeah, it translates so well to any number of inflammation processes.
Mhm. Okay. We could probably go on for hours yet, but we're coming close to what would be a good point to wind it down. Before we do, is there anything else that you wanna tell us that you think we should maybe know about it if we wanna explore this a little bit further?
Michael, it's a great tool. It's a great tool because it accelerates healing. It's a great tool because I had any number of patients over the years that were sensitive or skittish about needles, and this was a way around that.
Probably great for kids.
It was great for kids.
Mhm.
I didn't treat many kids in my practice. It was and would be great for kids. So I would say check out these resources and explore. Yeah.
I always like looking into something new. So, yeah, I'm going to go hop on YouTube.
Hop on YouTube.
Charlie, it's a pleasure to hang out with you again. Thanks so much for sitting down for this conversation.
Well, you're welcome. This was really a delight to me, and you talked about about what's dearest to my heart in my practice, which is frequency specific. So we did well.
Thanks.
So stay well yourself, and we'll talk.
Yes.
Okay.